very much, Joe, for inviting me. It's always a pleasure to be here in India, and to be here in 3A, being part of the board. It's always very nice to come back. I've been here once, it's the second time. It's very nice to see you all. As I was saying, this is the third time I'm speaking in a week. And the first one was about how we set up our monitoring and evaluation system in Mexico, with the challenges and what we found and what we have so far. Yesterday was about the importance of being independent and the importance of the structure of Coneval for us that allows us to be independent. And today is about how we measure poverty. So it's going to be a bit of more technical type thing. So I have to say that there are two people here who listened to me the 3 times. So you'll get an award after that. The award is I will be leaving tomorrow, so you won't leave me.
But Gonzalo is also a board member of 3IA, so you should all know that.
Thank you, Joe. So I think the interesting part here on the measure of poverty, there are 2 elements. The technical part, which is always very interesting, but also it's interesting the political economy of the process, because those 2 things are always important. So it's not true that poverty is only a technical issue. It's a very political issue as well. So the way we put it together on both elements are important. And I say that because we do have this new method for multidimensional, because it was a mandate by Congress. The Congress in the year 2005 said we have to create an independent body, Coneval. It's got to evaluate programs and policies on the social sphere, and it should measure poverty in a multidimensional way. So actually the law, the social development law, established very concrete characteristics for this poverty measurement. A, it should be defined both in the space of social rights and income. And this is very interesting because what the law is saying is that our constitution is very important in terms of social rights, therefore our poverty measurement should put that from the very beginning. I'm also saying that income is still very important, and for our method, income, as you will see, will be very important. Secondly, for public policy purposes, the methodology should make a closer link between social programs and poverty figures. And this is perhaps one of the most important elements of our multidimensional poverty, because there are many social programs that when you measure poverty with income, it's very difficult to have impact on income, let's say on water, sanitation, even schooling. I mean, of course, schooling and income are related, but you don't increase income when a child goes to school immediately. You have to wait a bit. So if you try to evaluate programs in terms of income poverty, you'll take, perhaps you won't have any impact. Whereas if you include certain social rights, as we will see, you'll have a quicker impact on poverty. So that's very important. And as I said, it should be measured by independent institutions. So these are the dimensions that the law obliges to incorporate in the measurement. A, we have income, it is there, but also we have educational gap, access to health services, access to social security, quality of houses, housing, access to basic services, access to food, and something which is kind of odd, which is a degree of social cohesion. I'm not going to talk about social cohesion right now, because what we actually did is we did not include that element on the indicator, but we compute that social cohesion on a separate element, because it was very difficult for us to include that as part of the formula. And we have to measure that for the national level, state level, and municipality level. And as you can see, those dimensions on yellow are in fact part of the social rights. So as I mentioned before, this is a very important element. Our method has a social rights approach and an income approach. Saying, it means that irrespective of the relationship between educational gap, between health services and income, irrespective of that, the social rights approach says, if you have education and health services, it is important on its own right. It doesn't matter if then you may have better income in the future because of that, but if you are an educated person, this is important by itself, which is behind the theory of social rights, let's say. When Coneval was set up in 2006, we started working on this method. So we started with consultation with many experts in the world, in Mexico. We asked Bourguignon, Forbeck, Cadwani, Nora Lustig, Manuel Scofield, many people, what were their thoughts about a multidimensional approach. But then we hired 5 specific people. We hired Mr. Chakravarti, James Foster and Sabina, David Gordon, and from Mexico, Julio Olvinic, Ruben Hernandez, and Humberto Soto. And we asked them, what would you do if you had the task to create a multidimensional indicator? At the same time, we had consultation with public institutions. We designed a survey specifically with the statistical office in order to have our database. We discussed the proposals. We did the data collection. We had various seminars, and we ended up in the year 2009. We ended up with our approach. So we took a bit of here and that from our colleagues, and we launched our method in December 2009. By the way, so as I said, we hired James Foster. He gave us very good ideas. We took some ideas from him. In fact, we took more ideas from David Gordon. But then James Foster thought it was a good idea to keep working on that. So a year later, they launched with Sabina their famous MPPI, which is part of the human report. So it was very interesting that they kept working on that, and it's kind of a different approach, but it is somehow linked. Well, another advantage of the social rights approach is that it somehow solves the problem of weights and thresholds somehow. Why? Because on the theory of social rights, these are indivisible, they are interdependent, which means that they all are equally important. So when we discuss weight, which is one of the most important elements when you put together an indicator with various dimensions, you always have to debate on the weights. So according to this theory of social rights, on the space of social rights, all of them are equally important, therefore the weight is equal among all of them. We may think that perhaps food is more important than housing, because you may die if you don't. So we may discuss a lot on that. But if you take the theory of social rights, that discussion is not there. All of them are important. The second element is that because we are linking our method with social rights, then already the Congress had set thresholds for certain dimensions. So for instance, 5 years ago, the Congress said that the minimum level for education was secondary education. So secondary education was the minimum level possible, and it was mandatory. Therefore, instead of all academics, our council members, debating about the threshold of health services or the threshold of education, we took what the Congress already thought about, which was a good idea to link. I mean, if our method came from Congress, let's then use Congress again for certain threshold, which I think we made sense. Therefore, our poverty measurement has a very normative approach as well. Of course, 5 years later, last year, Congress decided that the minimum level for education now is high school. Therefore, our threshold should be up again because of that decision of Congress. So,
can I just?
Yes.
So what is the threshold for food? Is there a threshold?
Well, no. So
for
on dimensions which we didn't have any threshold by Congress, then we constructed our own threshold. First was the law. Second, it was what the experts on public services told us to do. That was the case for housing. So we had an institution dealing with characteristics of housing. So we asked them what the threshold should be. So we got the threshold from them. And for income and from food, we constructed that ourselves.
And a second clarification.
Yeah.
So when you say social rights, these are universal rights.
That's right.
So the government is obligated to provide these rights to all Mexican citizens.
Or to guarantee the means for them to have it.
To guarantee them, okay.
Yeah,
So that's a difference.
That's a difference, yeah. That's right. That is right. So let me show you then the way we present the method in a very, hopefully, very simple way. So the task is putting all Mexicans on that square. So we're going to put them there, and we'll classify them by income and by the deprivations on social rights from right to left. So if I have time later, I'll talk about the thresholds we chose. But let's assume that we have thresholds in our 6 dimensions on the social rights. So our first approach, because we're talking about social rights, is the following. Let's map Mexicans without any deprivations, 0 deprivations, and those who have 1 or more deprivations. It doesn't matter which one is the one they have, because all are equally important. So this is our first approach, and this is a very important message for the Mexican government. So if we count the number of people there, our first message is, there are in Mexico so many Mexicans without access for minimum rights. Even 1 is important. So this is a very important message. There's a number of people without social rights on this earth. But then we thought, is it possible to identify poverty only with that? And we thought perhaps not. Because A, there may be people with with relatively high income, and it will be quite difficult to say that someone with very high income but without a proper access to social security, as it happens a lot in Mexico, may be considered poor. And secondly, we think that if we talk about poverty, it is very useful for the Mexican government to identify those who are suffering more in terms of income and in terms of social welfare. It doesn't mean that the guys with a deprivation and higher income are not important. We're saying if we should prioritize, let's start with those with lower income. And therefore, we have an income cutoff, the usual poverty line, but we don't call it poverty line because now we have 2 spaces. We call it an income cutoff. And therefore, we decided to identify poverty as those with more and severe problems in terms of income, and if they have at least 1 deprivation in the sphere of social rights. So those are our poor people in Mexico. As I said before, another option, we can discuss it later, it will be the union approach. So a union approach will mean that poor people will be these people, these over here, and those with low income. When you look at the statistics of these 3 different squares, the characteristics of the 3 of them are very different. And therefore we thought it was a better idea to identify as poor people on this, and then let's put on the map these other two elements, which I'll mention in a second. Also, we thought it's a good idea to also identify what we call the extreme poor in Mexico. They are those who are suffering more from income, and they have 3 or more deprivations at the same time. It doesn't matter which one they are, but the important thing of that is that these people are far away from this green place where ideally all Mexicans should be. All Mexicans should have relatively high income or not low income and without any social deprivation. In fact, this chart is being very helpful for us to try to convince the government that, of course, we want to have less people in extreme poverty and poverty, but at the end of the day, what we would like to have is all Mexicans on this green place. And extreme poverty is exactly on the opposite place. Those suffering more from income and from social rights. And now, for the same price of identifying poverty, we do have 2 other elements here. These people that we call vulnerable people by social deprivations, and one important example we have in Mexico, well, is a self-employed person. He may have an income of, I don't know, $3,000, $4,000 per month. It's difficult to think that he's a poor, but he doesn't have access properly to health services or to social security. It happens a lot in Mexico because social security goes through formal jobs. So if that person has suddenly an accident or an important illness, he will suffer twice. He will suffer the illness, and then he'll suffer how he's going to pay for those services. He may go back, he may enter poverty because of that, or he may not enter poverty. He may go from this place to this place, but nevertheless, he's a vulnerable person. So we call that vulnerable. And here is another vulnerability. A person which at the moment of the survey has a low income, but at the moment of the survey, he hasn't got any deprivations. Perhaps he had a bad month, a bad year in his small firm, or because of the country had a crisis. If that's a temporary problem, perhaps in 2 months' time, he will be back to the green spot. But if he spends enough time here, he may enter poverty because he won't have enough income to buy his or her social rights. Children out of school, moving from the house, not enough money to get your social security, which you can buy in Mexico. So this is very similar to David Gordon's approach to poverty. What he says, in fact, is that if we look at poverty like in this way, we can think as poverty as a dynamic element. So in his point of view, the dynamics go like this. These they call vulnerable people may enter poverty. And these people here will be catching up on their social rights because they will be getting enough money right now, and eventually in 1 year time they will have they will be moved to the green spot. So it's a dynamic way. Let me go back again to the public policy. We've showed this to the government to underline the following problem. For the past 20, 15 years, the Mexican government has spent a lot in social programs. Oportunidades, Seguro Popular, the meal program. And those programs have been successful somehow in moving people from, let's say, this place to having less deprivations. teachers go to school, they may have better housing. But it is very important for us to remind the government that if we don't do anything in Mexico in terms of income, reducing poverty will be very slow. It is very slow. We will have almost the same extent of poverty as we had 15 or 20 years ago, basically because if a country grows at 2% per year on average, it's very difficult for, no matter how successful are your social programs, that you can reduce poverty. Therefore, we think that the public policy to reduce poverty, extreme poverty, and if we end up here on the green spot, should be both with the traditional social programs if they are well designed, and with the economic element. And this is very important because for the past 12 years at least, when poverty goes up in Mexico, everybody asks the Minister of Social Development why she or he's doing a bad job. Why Oportunidades is not working properly. And no one asks the Minister of Finance or the Minister of Employment or the Minister of Economy, those in charge of productivity and growth, no one asks them anything. So we are trying to really move or convince even the media that the task for reducing poverty in Mexico, and perhaps in any country, all ministers are responsible for that, not only the minister dealing with social programs. So the figures for Mexico in 2010, now we have the 12th, I didn't have it. On 2010, the figures are as follows. 46% on poverty, if we use to housing and even to the educational gap. So these are good news. The government was not very interested in our multidimensional poverty measurement because it was kind of difficult to understand. You know, they were used to the old income approach. So when we got this in the middle of the government, last government, they were really confused. However, when they realized that this chart said the following, it says, we are able to say that due to public policy, certain aspects of poverty are improving. Then they got our attention. Then they said, well, this is a very good idea. One of the most important programs is this access to health services for poor people. It's called Seguro Popular. Well, this outcome of 9 million people is due because of that program. So they were really happy. Of course, the problem was that more people were earning low income. More people, 4.8 million people were now under the usual income line, and 3.5 on the lower line. And the other problem in the deprivation, more people were deprived for food. Basically, this was the financial crisis of 2009. If you add together everything, you've got an increase in poverty of 3.2%, but extreme poverty, which is there, is 0. In the middle of a very important crisis in Mexico, extreme poverty did not go up. It was due to 2 elements. These good news have been actually really well targeted to poor people, to extreme poor people. And secondly, the worst of the crisis happened on urban areas more than rural areas. So in Chiapas, for instance, their income was almost the same before and after the crisis. Whereas in Sonora, Nuevo León, Tamaulipas, northern states which trade more with the United States, their income suffered a lot. So due to that, we were able to say that poverty went up. So the government was not very happy that we said that. But extreme poverty did not go up. And all these better news were there. So this was appealing for the government, honestly. I'm about to finish.
So could I ask you
yeah.
So you have access to health services as a social right mandated by your constitution.
That's right.
Or by
That's right.
the government.
That's right.
But it's in some sense, I would look at it as an input rather than an output. If I've accessed health services but didn't get anything out of it, I'm not necessarily better off. So you're not measuring on the outcome space, but you're actually measuring my visit, I'm assuming, to the health provider. Is that?
In terms of health?
Yes, in terms, because it's access to health services.
Yeah,
It's
yeah.
actually not the product of having utilized that health service.
Can we deal with that later? This is a very important question which I really want to address. Let me just finish that, and then please remind me on that question, because it's very important. Just to finish, the new president last year established now poverty goals for all ministries. So it's not only the Ministry of Social Development dealing with poverty, it's also the Ministry of Health, the Ministry of Education, the Ministry of Agriculture. So those are actually good news. The new plan, the National Development Plan, has only 14 indicators. 2 of them are taken from the multidimensional poverty method. Even opposing political parties and the media are using these figures, and they think these are valid and transparent figures, apparently. We think that measuring poverty this way can help governments to do better in terms of policy. Because as I said, it is now possible to evaluate programs in terms of poverty, not income poverty, which is more difficult for certain programs. And we think that poverty is a multidimensional phenomenon and must be tackled this way in order to have better policy. So I finish here, Ajay, and then we can carry on with some interesting.
Thank you very much. Do you want to address this question now or later, maybe? We'll
It's
take
up to you.
later.
It's up to you. It's up to you.
Uh,
Yeah, but perhaps we can address it.
maybe.
Yeah. So
Since she's waiting for later.
No.
So-
Just curious.
So we have poverty figures, but we are able to get also the deprivations separately. So this is the educational deprivation, that's the health, and this is the income element, and these are the thresholds. Let me go to the where is this? Oh, I can't go back. So, one of the most important questions we've had on this method is your question. In terms of health services, we only are able to measure if, with a census, if the person has access, has the right to enter an institution, either a private institution or through the formal job to a formal institution of health, and with a new health services for poor people to the new one. We cannot measure if the quality of the service was right, if they were treated properly, or even if they solved their problems. We cannot do that because we don't have enough. With this, if we wanted to have a methodology linking national, state, and municipality level, we don't have enough data to do that. We do have studies which can show you that those problems only on a national basis. So, as a complement to this method, we do have specific studies on access, proper access to health services and the use of them, and how the quality is being taken into account. So we do have them as a separate study, but we do not have this embedded in the methodology.